Any heart symptom comes with chest pain mainly. But what is a type of chest pain which could be related to the heart is what common people need to understand. Females may not feel chest pain at all. Physical fitness is one thing, but that's not the whole story. So Sorbitrate has been marketed as an emergency pill for heart attacks, but it is not really for heart attacks. I know vaping is marketed as a safer alternative to cigarettes. They do not have any nicotine content at all, but that's not true.
Basically, a big no to vaping.
Once a year, they can get their ECG, lipid profile, sugars and blood pressure. This check, echo they can do every 3 to 5 years.
पिक्चरों के अंदर भी कभी फीमेल्स में नहीं दिखाते. It's more about the men's getting heart attack. तो वहाँ से
It used to be correct.
मुझे कुछ घबराहट हो रही है सुबह से, मैं थोड़ा अनईजी फील कर रहा हूँ. मेरे को ECG क्या उसी समय करवाना है जिस समय मेरे को दिक्कत हो रही है, या फिर मैं कभी भी करा सकता हूँ, तो तब भी उसमें वो चेंजेस दिखते हैं. What should be done at a certain interval that ensures कि हाँ हमारा हार्ट हेल्थ ठीक चल रहा है.
They do not have very typical cardiac symptoms or very limiting cardiac symptoms. They can get a CT coronary angiography done.
Hi. I'm Rahul from Vcare Health India. आज हमारे साथ डॉक्टर हरनीश सिंह भाटिया जी हैं. He is a DM cardiology and he is currently serving at Max Super Specialty Hospitals, Delhi. Today we are going to discuss a very important topic of young people getting heart attacks. तो सर थोड़ा सा आप बताएं कि what is the reason कि आजकल हम देख रहे हैं 25, 26 साल, 30 साल के लोगों को हार्ट अटैक आ रहा है.
Absolutely. So it's very true that young people are getting heart attacks very commonly. You said 37. I've seen people even up to the ages of 18, 19 getting heart attacks, and I've undergone angioplasties for that. The four main reasons why I feel this is happening is this change in demographics is happening is number one, because of the increased sedentary lifestyle which we're having in our day-to-day life. More of desk job, more of screen time, less of walking and less of physical activity.
कुछ करने के लिए जरूरत नहीं, आप फोन उठाओ, ऑर्डर करो, सब घर आ जाएगा.
Exactly.
You don't need to move at all basically.
Right. So sedentary lifestyle is very harmful. It leads to development of blood pressure, sugar, and all of those things. Second is increased level of stresses in our lives these days. Job stress, family stress, and lots of stresses of other types. They lead to the release of a lot of stress hormones, which lead to damage to the heart ultimately. Third, I feel, is smoking and vaping culture, which we have, which has become very prominent in our society these days. That leads to a lot of damage to the heart. Fourth is dietary habits. Eating of more of processed foods.
हर चीज पैकेट में से आती है आजकल.
More of sugar-rich food. We are having more of cokes and chips these days. They're very high in carbohydrates and sugars. They also lead to damage to the heart. So these are the four main reasons for the development of early heart disease in young adults.
कोई भी young person है, like they're feeling some pain in chest or some uneasiness, some high BP. So what is the danger sign? ऐसा क्या है जो वो देखें और जिसको फिर they have to go to a doctor? Like what are the danger signs for that?
So basically, what I understand is you were trying to ask me what are the signs which can signify that it could be related to the heart.
Yeah.
The most important way to identify any pain related to the heart. See, any heart symptom comes with chest pain mainly. But what is the type of chest pain which could be related to the heart is what common people need to understand. Kind of pain which is related to heart is something which increases with exertion. Okay, you feel in the center of the chest there is a pressing sensation, there is a crushing sensation, and it's not localized to one point like it's here, all over the chest. Sometimes it comes to the jaw, sometimes it comes to the arms, sometimes it may be an isolated jaw pain. You may not feel any chest pain at all. Especially this happens in females. Females may not feel chest pain at all. It may be a jaw pain and you may feel like it's some dental problem, but it may not be actually a dental problem. It may be a problem related to the heart. So we need to identify these type of pains. The most characteristic feature of a pain related to heart is that increases with exertion. Like for example, if you're walking 2 flights of stairs, you're walking up the stairs for 2 floors, and so the pain starts after 2 floors, and then when you take rest for like 5 minutes, the pain subsides. So this is the kind of pain which could be related to the heart. Sometimes it may be associated with say breathing difficulty. Sometimes it may be associated with sweating, a lot of anxiety, uneasiness. So all of these symptoms can be related to the heart.
Sports persons हैं या fitness enthusiasts हैं जो बहुत ध्यान रखते हैं अपने खाने का, अपने पीने का, अपने सोने का, अपने रूटीन का, they're regular gymmers, उनको भी यंग एज में ऐसा हो रहा है. तो ये तो सर कहीं समझ में नहीं आता. मतलब
physical fitness is one thing, but that's not the whole story. What we usually see is that people who are more into fitness, who are more into exercising and gymming, they usually end up taking more of unregulated supplements. The problem with these unregulated supplements is, especially those which are marketed as pre-workout boosters and those which are marketed as fat burners, they have a lot of stimulants. These stimulants in the long run, they increase the heart rate, they increase the blood pressure, which ultimately leads to damage to the arteries of the heart. So these damage, which slowly goes on developing, leads to formation of plaque in the arteries and leads to heart attacks. This is number one. Second is extreme exercises, high intensity workouts, which are not regulated, which are not supervised by a trained professional, and which have been done without preconditioning the body. Like, for example, a person who's been working out for many years may have the ability to perform a certain sets of exercises, but another person who's not been trained in that for many years, if that person starts exercising in the same amount at the initial stages itself, the heart may not be able to cope up with that excessive stress. So this excessive stress also leads to heart attacks. Thirdly, what I feel is not being able to regulate diet along with that. So for example, a lot of people you will see in the form of being fit, they are taking keto diets, they are taking very low carb diets, and which are not being supervised by a trained dietitian. What happens is with these low carb diets, the essential nutrients which the heart and your body needs may not necessarily reach the body and the heart. So that also leads to decreased functioning of the heart and ultimately lead to damage to the heart. So these are the main reasons that even though you may look physically fit, but deep inside you're not. Physical fitness is one thing, but it's not the complete story. It's not the entire cardiac health of the person.
दिख रहा है कि you have a good lean body, you have a good
Yeah.
muscle mass,
Yeah.
but internally your organs like your heart, your liver may
Exactly.
not be able to
Exactly.
cope up to the stress of amount of exercise you're giving your body.
Exactly. And instead, it's more of that the people who may look physically fit, they
Yeah.
may be consuming substances to keep it that way, and which
Yeah.
may actually
Yeah.
harm the body.
A lot of people do steroid cycles
Exactly.
to gain instant results.
Steroids are the cortisol enzyme which we talked about previously is nothing but the stress hormone. It's a steroid hormone which our body naturally produces. So if
Yeah.
you're taking steroids from outside, steroids are stress hormones, so they're
Yeah.
increasing stress inside the body. They are making the heart work more and more, which the heart is not naturally intended to. So that causes damage to the heart ultimately.
Flight and fright mode में चला जाता है.
Yes.
Got it.
A flight and fight mode is a natural response of your body to stress, but that is to a temporary stress. The heart can have the flight and fight response for some time, but it needs to come back to its natural form later on. But if you keep taking steroids all the way long, 24 hours your heart has to work on the flight and fight response, and the heart cannot do that. So that is the reason.
मेरा भी आज तक का कॉन्सेप्ट यही है कि अगर किसी को हार्ट का प्रॉब्लम हो रहा है तो हम नॉर्मली सॉर्बिट्रेट दे देते हैं, या लोग भी हमारे पास आते हैं वो कहते हैं कि भाई सॉर्बिट्रेट अपने वो पर्स में रखते हैं, घर में जगह जगह रखते हैं कि अगर कोई दिक्कत हो जाए तो सॉर्बिट्रेट दे देंगे हम.
Correct. So Sorbitrate has been marketed as an emergency pill for heart attacks, but it is not really for heart attack. जैसे कि we have discussed already, Sorbitrate is nothing but a dilator of the artery. If the artery is, say for example, 90% blocked, 80% blocked, it will help to dilate the artery and make some way for the blood to go. But if suppose the artery is 100% blocked, it cannot dilate the artery anymore. So there you need a blood thinner like Disprin. Sorbitrate will be useful उन patients में सपोज किसी की एंजियोग्राफी हो रखी है, उसे पता है कि उसे 90%, 80%, 70% के 4-5 ब्लॉकेजेस अलग अलग आर्टरीज में हैं, क्योंकि ब्लॉकेजेस इतने ज्यादा हैं उन्हें खोला नहीं जा सकता, दे आर नॉट अमेनेबल टू स्टेंटिंग एनीमोर. तो ऐसे पेशेंट्स में उन्हें थोड़ा बहुत चलने पे दर्द होता है, रेस्ट करने पे थोड़ा आराम आ जाता है, तो कभी उन्हें अगर सीवियर चेस्ट पेन हो जाता है, so they can take a Sorbitrate, they will feel relief in the chest pain. So Sorbitrate is for those patients. Disprin is for the patients who have acute heart attack. Sorbitrate is not for acute heart attack.
So to keep it simple for the audience, it is simple as that कि अगर कोई ऐसा लग रहा है किसी को कि भाई हार्ट अटैक जैसा हो सकता है,
बिल्कुल,
सिंपली टेक अ डिस्प्रिन.
करेक्ट.
अगर ले सकते हैं तो पानी में घोल के फटाफट ले लें, या फिर सीधा उसको मुंह में रख लें जबान के नीचे.
करेक्ट.
और डिस्प्रिन फटाफट एब्जॉर्ब हो जाएगी और इमीडिएटली ब्लड को थिन करेगी ताकि ब्लड फ्लो कर सके. और आपको कुछ और समय मिल जाएगा, एंड देन अल्टीमेटली अगेन यू हैव टू रश टू हॉस्पिटल ओनली. It is not कि आपने घर पे हैंडल कर लिया उसको.
This is true. We're talking about patients who do not have any cardiac history per se. For the first time, they're experiencing such severe excruciating chest pain, which is looking like a heart attack. Best treatment at home for them before they can reach the hospital is a single tablet of Disprin 325 milligrams.
सर आजकल ना वेपिंग बहुत कॉमन हो गया है, एंड मतलब मैं आई सी यंग इवन स्कूल किड्स डूइंग वेपिंग, अज्यूमिंग कि यार ये तो हार्मलेस है, वो छोटा सा होगा, उसको वो कर रहे हैं, बड़ा अलग अलग फ्लेवर्स हैं,
Absolutely,
तो
yeah.
क्या वाकई में सर ये मतलब इज इट सेफ?
I know vaping is marketed as a safer alternative to cigarettes. Vaping is nothing but e-cigarettes. For viewers who do not know what vapes are marketed as e-cigarettes. They run on batteries. They are marketed as if they do not have any nicotine content at all. But that's not true. Even vapes do have nicotine in it. And as we know, nicotine, which is present in cigarettes, is also present in e-cigarettes or vapes. And it leads to formation of atheromatous plaques. So even though vapes are being marketed as a product which is cardiac safe, but they are not cardiac safe, they definitely lead to increase in oxidative stress inside the arteries and lead to damages to the arteries and blockages ultimately.
तो बेसिकली अ बिग नो टू वेपिंग।
Definitely.
मतलब ये अपने आप को भुलावा मत दो कि भाई हम वेपिंग कर रहे हैं तो आप सेफर साइड पे चल रहे हैं, ऐसा नहीं।
Definitely. And even some people may say that people who are smoking cigarettes can turn to vapes and it will lead to lesser damage and slowly they can just leave it and then just quit everything. But even that is not a very good option because vapes are definitely not, they may be slightly safer than cigarettes, but they are definitely not 100% safe. So instead of choosing vape, just leave it, just quit cigarettes altogether, because if you're choosing vapes, you're leaving one harm for another harm.
Younger people of 20 to 30, what they should get done?
Correct.
And for 30 to 40, what
So
they should
here we're
get done?
talking about patients who have no symptoms.
Yeah,
They just
exactly.
want to check whether their heart is fit or not.
Yes.
Starting from the age of 18, let's talk blood pressure, sugars, cholesterol and ECG. This much starting from the age of 18, and then you can, if they come normal, you can repeat it every 3 to 5 years. Starting from the age of 35 to 40 years, you can get your echo done. If you have any mild symptoms, you can get your stress echo done, where you have to walk on a treadmill and then the echo is done. That is called a stress echo. And if you have strong family history, you do not have any symptoms, you do not have any risk factors, but there's a strong family history of heart disease, get a CT calcium scoring done.
तो सर ये हुआ 40 तक का एज ग्रुप। व्हाट अबाउट 40 प्लस? क्योंकि मैंने देखा सर मैक्सिमम पीपल गेट बीपी, शुगर, एवरीथिंग प्लस 40। द मोमेंट दे क्रॉस 40, एवरीथिंग स्टार्ट्स टू कम इन। So what do you recommend for 40 to 50 age group or 40 to 45
like
age
I said,
group?
stress echo is recommended if they have minimal or no symptoms, but if they have symptoms, then they should go for CT coronary angiography.
Definitely, and obviously if somebody is having prominent symptom, then directly go to a doctor. Don't do it on yourself.
Beyond that age, you should just get echo and stress echo done every 3 to 5 years. More frequent than that is not required. And if you do not have any symptoms, no family history, no risk factors like hypertension, diabetes, even CT coronary angiography is not required.
So sir, for an average healthy person who is at an age of 50 plus,
correct,
so 50 plus to 55 or below 60, for that average person, what they should be getting done once a year?
Once a year. So if they have not been tested before, once a year they can get their ECG, lipid profile, sugars and blood pressure, this checked. Echo they can do every 3 to 5 years, and stress echo also they can get it done if they want complete clarity about their exercise capacity also.
General notion that females have a lesser chances of getting a heart attack. हमने भी मतलब मैं भी देखूं तो मेरे नॉन में ज्यादा लोग जिनको हार्ट अटैक हुआ है, they are more on the like males. So is there a clear reason for that, or is it true?
Earlier there used to be this conception that females have slightly lesser incidences of heart diseases in general, and there used to be a reason also for that. The reason being that as long as a female is menstruating, so a normal female has menopause around 45 to 50 years of age. So as long as a female is menstruating, the hormones in her body protect her from development of heart diseases. So that is the reason heart disease used to be slightly lesser in females, and even when they used to happen, they used to happen a decade later compared to men. So suppose average age of happening of starting of heart disease in a men would be around 50 to 55. In female it would be 60 to 65, because she was protected through during her menses for the heart diseases. Over the years, this demography is changing now with increased smoking, increased stress, increased obesity, increased PCOD, increased physical inactivity. This demography is slowly changing, and now we commonly see young females also developing heart attacks. So earlier there used to be this conception, this is correct, and there used to be a scientific reason also for that, but slowly these protective mechanism is melting down, you can say.
क्योंकि सर एक ना जनरल है, पिक्चरों के अंदर भी कभी फीमेल्स में नहीं दिखाते, इट्स मोर अबाउट द मेंस गेटिंग हार्ट अटैक। तो एक वहां से
it used to be correct, but
बन जाता है।
as young MIs are increasing, young heart attacks are increasing, the young heart attacks are almost equal in men and women.
जब किसी को कोई अनइजीनेस हो रही है, जैसे मुझे कुछ घबराहट हो रही है सुबह से, मैं थोड़ा अनइजी फील कर रहा हूँ, मेरे को ईसीजी क्या उसी समय करवाना है जिस समय मेरे को दिक्कत हो रही है, या फिर मैं कभी भी करा सकता हूँ? तो तब भी उसमें वो चेंजेस दिखते हैं या नहीं दिखते? फिर वो
चेंजेस बाद में भी दिख सकते हैं, प्रोवाइडेड कि कोई ब्लॉकेजेस हो. समटाइम्स यू फील अनईजीनेस विच मे नॉट बी रिलेटेड टू हार्ट. It may be some gastric problem or something, so that will not show any changes. But if possible, get the ECG as early as possible, because a pain which happened or uneasiness which happened for a few minutes and then it became better may be a sign for an impending heart attack. So you don't want to wait कि मुझे सुबह दर्द हुआ, आज मैं अपने ऑफिस में काम कर रहा था. You don't want to wait till evening, because in the meanwhile something abnormal can happen. So even though evening ECG will also show changes, but you don't want to wait till evening because something worse can happen in between. So you get the ECG as early as possible. That is why it is advised.
मतलब कितना % चांसेस हैं कि वो चेंजेस हमें दिखेंगे या नहीं दिखेंगे?
Any blockages which are more than 90 to 95% involving a significant territory of the heart, meaning involving the main branches of the heart, will show ECG changes. But suppose the blockages are less than that, say 60%, 70%, they may not show any ECG changes. Suppose the blockages are more, 90%, but they are in the smaller branches, smaller arteries, they may also not show any significant changes. So there's no straightforward answer to it. It's a very complex thing.
Got it. But bottom line is, as soon as you experience something, get the ECG done, or better get directly go to the hospital or the doctor.
Reach your cardiologist. Yeah. Your cardiologist will know what battery, because there's so many tests in cardiology. You can get an ECG done, you can get an echo done, you can get a stress echo done, you can get a treadmill test done, you can get cardio biomarkers like troponin I, troponin T done, then you can get a nuclear scan done, you can get a CT coronary angiography done, you can get a normal conventional angiography done. Which test is suitable for which patient? Your cardiologist can determine the best.
सर, लिपिड प्रोफाइल में एक टेस्ट हम सुनते हैं आजकल, एक्सटेंडेड लिपिड प्रोफाइल और एपोलिपोप्रोटीन्स. करेक्ट. AB. इनका सर क्या रोल है? कहाँ, किसके लिए वो रिकमेंडेड है, क्यों करते हैं हम?
करेक्ट. सो एपोलिपोप्रोटीन के बारे में, इट्स अ नॉन मॉडिफाइबल रिस्क फैक्टर. सो देयर आर सम रिस्क फैक्टर्स which are modifiable, there are some which are non-modifiable. Like cholesterol is a modifiable risk factor, you can control it with diet, with medicines. Sugar is a modifiable risk factor, you can control it with diet, with physical activity, with medicines. Again, blood pressure is also modifiable. Apolipoprotein A1 targets the genetic component of heart diseases. So if you have strong genetic history which is related to your heart diseases in your family, your apolipoprotein A1 will be high, so it cannot be targeted with any medicines, it cannot come down. So apolipoprotein screening is recommended at the age of 18 for patients, for people who, they are not patients, for people who have family history of heart diseases. They can get their apolipoprotein A1 checked only once in life. You don't need to recheck it again, because the levels are going to be same all throughout your life. So get it done only once in your life, starting at the age of 18. If you have family history of heart disease. Even if you do not have family history of heart disease, you can get it checked at the age of 25. And the only reason why we're checking it is to stratify the risk of developing heart diseases. So if you have high apolipoprotein A1 level, you have more chances of developing heart disease in the future, in your 50s and 60s. So that way you can be more cautious about your lifestyle changes and everything.
Got it. तो सर ये 2-3 तरह के होते हैं ना इधर? Apolipoprotein
only apolipoprotein A1 is what we do.
What is for the B1? That is,
there are different components of there's so many proteins in our body which have different components, but the ones which we check and the ones which are clinically useful are very less. So apolipoprotein A1 is the one which we use.
What I understand from this conversation, sir, because it's to be done once in a lifetime.
Yeah.
In general.
Yeah.
So a person should get it done at least once, whatever the age is, right?
Like I said,
18 plus.
With family history of heart disease, you should do it at the age of 18. Without family history of heart disease, you should do it at the age of 25. If you are more than 40 or 50 years of age and if you have never done it before, get it done right now.
Right. It's an important test.
Yeah.
Normally, लोगों को पता नहीं होता इसके. There are very few people, I think cardiologists are the only one who get it done.
Yeah.
Usually, people are not getting this test, and we get very less requests.
It is just to stratify the possibility of developing heart disease in the future.
Got it. What should be done at a certain interval that ensures कि हाँ हमारा heart health ठीक चल रहा है?
If a person is having reasonable amount of symptoms and they have some risk factors also like blood pressure, sugar, but they do not have very typical cardiac symptoms or very limiting cardiac symptoms, they can get a CT coronary angiography done, which is a non-invasive angiography. So earlier we used to do angiography, where we used to put a catheter inside your heart and check. That is also recommended for patients who have high suspicion of heart disease. Like for example, someone who has ECG changes, significant amount of chest pain, heart attack, lingering heart attack going on. There we recommend to do a normal conventional angiography. But for patients who have mild symptoms, some risk factors, not very significant ECG changes, you can get a CT coronary angiography done. It will give you a good amount of idea about the blockages also. So these are all the cardiac tests. So we do cardiac biomarkers for patients who have acute onset chest pain, like troponin I, which we talked about. We do troponin I in those patients who have had chest pain of recent origin, like last a few hours or few days. Only in those patients, troponin I is useful.
It is more catastrophic in younger population. When we hear कि okay there's a heart attack and the person, like we simply see कि okay heart attack हुआ और आदमी गया, like they don't survive, or the survival rate is lesser. In comparison, I have seen people in the older ages getting more episodes, like एक बार हुआ, दो बार हुआ, तीन बार हुआ, और young age में हम देखते हैं कि एक ही बार हुआ और आदमी गया. Why is it so?
This is true to some extent, but this is not 100% true. Meaning ki usually what happens is that the younger people, they have, when they develop heart attacks, they have one or two blockages only. So their entire coronary tree is not blocked. So whenever one or two blockages happen, if they happen in the very proximal and very important vessel, very important artery, that can be catastrophic, that's for sure. Contrary to that, in older people, usually they have more number of blockages. So what happens is they have more formation of collateral vessels, and the heart is preconditioned. It is called as preconditioning of the heart. The heart is preconditioned to tolerate ischemia better. Ischemia is nothing but deprivement of the heart muscles of oxygen because of the blockages. So their heart muscles are more tolerant to development of ischemia. So the consequences of heart attacks are usually less pronounced in those people who have small blockages but more number of blockages. So they may have multiple 70-80% blockages all throughout the coronary tree, and then when 100% blockage suddenly develops, their heart is already preconditioned to tolerate it better. So that's why probably older people have less catastrophic events compared to younger people. But this entirely depends on which part of the coronary tree the blockages have developed in. So an older person may have a blockage in the very proximal part, very important part of the artery, and that may be catastrophic, and a younger patient may have in a smaller artery, and that may not be catastrophic. So this can be anyways. It is not 100% true that younger people have more catastrophic events, but yes, there is some preconditioning in the older people which makes them slightly immune to the consequences of heart attacks.
The takeaway for this normal person is that because they have earlier experienced less flow of blood, so
Correct.
body it's developed supplementary lines,
Collateral vessels,
through
which the muscles are already getting some amount of blood. So even if the main artery gets blocked suddenly, that is nothing but development of a heart attack. The muscles have alternative sources of blood supply, and not just that, the muscles have modified themselves into in such a way that they can survive with less oxygen also.
Preconditioned.
That is called as preconditioning.
Conditioning.
Correct.
अपने आसपास में हम देखते हैं कोई भी सिम्टम आ रहा है, उसको चेस्ट पेन लग रहा है या कुछ अनयूजुअल चीज हो रही है, तो उसमें what first thing they should do or what we should do?
अगर हमारे आसपास किसी को ऐसे सडन चेस्ट पेन फील होता है, like we have discussed the pointers which point towards a cardiac nature of chest pain. If you feel it's that sort of a chest pain, the first thing that you do is you ask for help immediately. Call the emergency services and try to move to the hospital. By the time the professional help arrives, in the meanwhile, you can make the person as calm as possible. If the person becomes more anxious, the complications of heart attack will go on increasing. So you have to make sure the person sits or lies down, is not walking or standing. Make the person calm and relaxed. If you have Disprin at home, make sure that you give 300 milligrams of Disprin to the person, because Disprin, what it does is it's a blood thinner. It will reduce the formation of clot inside the arteries, and even if some clots have already formed, it may slightly melt them away. So the patient may have some relief in the chest pain. Thirdly, if the patient becomes unconscious, then you have no other option but to start CPR. The basics of CPR everybody should know. First of all, you assess whether the person is able to breathe or not. If the person is not able to breathe, you start chest compressions. So chest compressions, you put your one hand in the middle of the chest between the two nipples, and you put the other hand on top of the first hand, interlock both the fingers, and you begin chest compressions at the rate of around 100 to 120 compressions per minute. So that's a bit fast. And make sure that every time you compress the chest, it's at least 5 centimeters deep into the chest, and make sure that the chest rises back fully before you do the next compression. Until the patient starts breathing again, or until the professional help arrives, this is what you need to do for that patient.
So my takeaway from this is that first, do not try to deal it yourself. In a sense that
you first thing you do is you ask for professional help.
Call ambulance.
Yes.
Right. Either you rush to a hospital nearby,
yes.
or you call ambulance.
Correct.
जो आपको आके assess करे, help करे, क्योंकि those moments are very precious.
Correct.
वो 5-7 मिनट, 10 मिनट, 15 मिनट बहुत वाइटल हो सकते हैं आपका. उस समय पे अगर आपने टाइमली if you reach to the facility,
right,
then doctors are able to.
In cases of heart attack, there's a common saying which says time is muscle. So as early as you reach the hospital, as many heart muscles you can save. If you reach late, the more heart muscles are going to be damaged forever.
And they're not going to get revived.
They're not going to get revived if you become too late. So that's why people who live with heart failure, so they have one episode of heart attack, the pumping of their heart, or what we call as ejection fraction, reduces, and then they have to live permanently with that reduced ejection fraction, just because they could not reach the hospital at an early stage. If they reached hospital within, say, first 1 to 2 hours, the heart can become completely normal later on.
जो initial time है फटाफट से आपको hospital पहुंचना, that is the most important thing.
And there are common myths in the society कि अदरक खिला दो, ये कर लो, वो कर लो. These things do not help. Only thing which you can do at your level is you can give 1 tablet of Disprin. I would request everyone to keep Disprin tablets at home. Even if it's not available, you can just walk into the nearby pharmacy. Disprin is available over the counter. You can just purchase 1 tablet of 300 milligrams of Disprin and give it to the patient.
So Sorbitrate हम सुनते हैं आमतौर से कि अगर किसी को हार्ट अटैक जैसा एपिसोड हो रहा है तो उसको Sorbitrate दे दो.
Correct. So Sorbitrate is not recommended for heart attacks. Number 1. So this is a big myth which I must clear right now.
So aspirin should be used.
Aspirin or Disprin, both are the same things, that should be used.
Okay, normal से जो Disprin
normally we recommend Disprin and not aspirin. Comes in various names. It comes as Ecosprin, aspirin, Disprin. Disprin is the chewable form. So you can just put it in the mouth, it just melts and it goes into your blood circulation really fast. While if you take the normal aspirin or Ecosprin tablets, they'll have to go inside your stomach, get absorbed in the blood, so it will take a lot of time. So that's why Disprin is the one which is advisable to take.
So normal जो एक tablet Disprin का होता है, that is one is enough or we need to take?
No, 1 tablet is enough. 1 tablet of Disprin comes in the form of 325 milligrams. Okay. That is what is recommended. Just 1 tablet, do not take more than that. Because it's a blood thinner. It's a blood thinner. If you take more, it can lead to bleeding also. So take only 1 tablet, and you can put it in water also, or you can just put it below your tongue also. It will get absorbed. Both the ways are doable.
Okay, so sir, thank you so much for all the information, for all the knowledge. आज काफी कुछ सीखा हमने, काफी सारे मेरे concepts थे जो clear हुए, काफी सारे myths थे जो हमारे टूटे. Right. And looking forward to do this once again.
Thank you so much, Rahul. There are so many myths which are related to heart diseases which are prevalent in general population. We can probably do a specialized series in it. What are the myths related to heart diseases and what are the correct facts in terms of that. We can probably plan it in the future. And thank you so much for having me. It was a lovely experience.
Same.
We'll do it more together in the future. Thank you.
मैं रिक्वेस्ट करूंगा कि आप हमें प्लीज सब्सक्राइब करें, फॉलो करें. हम सभी मेजर चैनल्स पे अवेलेबल हैं. हम यूट्यूब पे हैं, इंस्टाग्राम पे हैं, फेसबुक पे हैं, ट्विटर पे हैं, लिंक्डइन पे हैं, सब जगह पे हैं. प्लीज आपके क्वेश्चंस, आपके कमेंट्स डालिए कमेंट सेक्शन में. क्या टॉपिक आप चाहते हैं हम आपके लिए कवर करें, कोई सजेशन हो आपका इम्प्रूवमेंट के लिए हमारे लिए, तो प्लीज वो रिकमेंड करें. थैंक यू सो मच.